My name is Kevin Blyer. I'm a proud community representative volunteer for the New York City chapter of the Alzheimer's Association. And I should say at the outset that as someone who has cared for someone confronting dementia, in fact, my own mother, Maureen, this session, as you can imagine, is particularly meaningful to me. And I am, of course, grateful for the work of our guest, our Ask the expert, Dr. Michelle DeStefano, who's with us. And with that, I should also mention, please keep in mind that you can turn on the captioning for this session. I'm sure that if I asked for a show of hands of anyone on this call who knows someone diagnosed with Alzheimer's disease or another dementia, well, I'm guessing that all the hands would be up. We know, as this next slide suggests, that the prevalence of dementia is somewhat staggering. Nearly 7 million Americans have been diagnosed with Alzheimer's, a number that is expected to double in the next 25 years. It is, as we've experienced, a pretty sobering reality. At age 45, and I'm older than that, the likelihood of developing Alzheimer's is 1 in 5 for women and 1 in 10 for men. And what's more, over 11 million Americans dedicate their time to provide unpaid care for people with Alzheimer's or other dementias. Now, of course, each of these people, those with dementia, those caring for those with dementia, are the inspiration for the mission of the association, which is namely, in the next slide, to lead the way to end Alzheimer's and all of the dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. Now, just to make sure we're all on the same page with some important definitions, on the next slide, as I mentioned here, when we say dementia, that's actually a general term for what you experience, what you've seen, a loss of memory, cognitive decline, difficulties in problem solving that interferes with daily life, behavior, and worst of all, personal independence. And Alzheimer's, yes, is the most common cause of dementia. It accounts for between 60 and 80% of the cases, but it's not the only one. The next most common, a term you may have heard before, is vascular dementia, which occurs because of blood vessel blockage in the brain primarily. And then there are others, as you see, including simultaneous types of dementia, which is considered mixed dementia, and other conditions that cause the symptoms of dementia, but some of those are reversible, such as thyroid problems and simple vitamin deficiencies. And on the next slide, while Alzheimer's is the most common cause of dementia, it's important to realize that it is actually not just a normal part of aging, which you might have heard. Age, yes, is the biggest risk factor. A majority of people with Alzheimer's are 65 years and older. And for those under 65, it's considered early onset. My mother had early onset. She started experiencing symptoms around 60 years old. And yes, Alzheimer's is what's known as a progressive disease where symptoms gradually worsen. Nevertheless, and I think this is a theme of the day, there are clear benefits to receiving an early and accurate diagnosis, including an opportunity to explore those treatment options which are available and are growing, and to make plans for the future, regardless. In the next slide, you'll see that it is the case that some populations are at higher risk. Alzheimer's has a disproportionate impact on Black Americans as well as Hispanic Americans, and there's a disproportionate impact on women. In the US, more than 11 million women are either living with Alzheimer's or caring for someone who has it, and almost 2/3 of Americans living with Alzheimer's are women. With those stats in mind, the Alzheimer's Association is committed to engaging underrepresented and underserved communities and to addressing this disproportionate impact. But as the next slide suggests, for everyone, we know that being a caregiver for someone confronting Alzheimer's can take a toll, and it can be a devastating toll. It was devastating for my family, but we got through it. It's a physical toll, an emotional toll, and a financial toll. And what's more, the demands of caregiving can affect a caregiver's ability to take care of themselves. That was an issue within my family. Caregivers are at an increased risk for anxiety and depression, not to mention that cost. The lifetime cost of care for individuals with Alzheimer's is more than twice that amount incurred by those without Alzheimer's, which, as you can imagine, makes that anxiety and those worries a vicious cycle, doesn't it? So next slide, which all redounds and makes clear and makes plain the importance of early detection. The earlier someone is diagnosed, the more treatment options there are. You'll see here 10 warning signs to look out for. Certainly with my mother, the first thing we noticed was some memory loss. She would ask the same question more than once in a fairly short phone call. And as interestingly, as the son who would call home from across the country, she was in Oregon, I was in New York at the time during the early onset, I noticed that memory loss perhaps more acutely and, dare I say it, earlier than people who saw her every day and saw it appear gradually. And early detection, as the next slide suggests, is important because when it is caught early, some lifestyle changes, both simple and more profound, but the simple ones, such as exercise, controlling blood pressure, stopping smoking, can be hard but important, and staying socially active, that's a simple one, can help preserve cognitive function. With this early detection, families also have that important opportunity, frankly, to maximize the time together, take advantage of the time you have, and importantly, engage with the support programs like those the Alzheimer's Association offers. So simply, we have to urge you to, if you notice those warning signs, don't just wait till tomorrow to notice them again, and tomorrow to notice them again, but to schedule an appointment with your doctor or call the Alzheimer's Association. They can help out with those administrative concerns. Because, as the next slide, it's a happy slide, says there are treatments. While this is still an uphill climb, as you may have heard, but the FDA has approved a number of promising medications, both recently and on the horizon, which either slow the progression of the disease or address, importantly, the symptoms of the disease, which, as a practical matter, can be just as important. Next slide would ask the question, what does science actually say about this brain health and these concerns about the brain? This research that we've experienced through the Alzheimer's Association is evolving, but the evidence is strong that people can reduce their risk of cognitive decline by making those lifestyle changes that I hinted at. And I think that, the central point there, that third point down, is a great one. It's basically a good mantra to have, which is what's good for the heart is good for the brain. So why not start now and do things that are good for both? And to that end, on the next slide, the association, you'll see, promotes 10 healthy habits that are especially good for that brain health, and they're listed here. For me, it's all about, I guess you'd call it number 3 there, moving as much as possible. I personally, I'm not getting any younger, so what I try to do is walk at least 5K every day, and running, frankly, just enough of that so that at least one drop of sweat, furrows on my brow or appears on my brow. I also do the other things like try to control blood pressure. It's been high most of my life, and medication helps with that as well. And then I try to sleep well. Now, if I could just stop grinding my teeth, I'd be in great stead. On the next slide, as you can tell, there are many reasons to feel hopeful about our vision for a world without dementia. And while the Alzheimer's Association is leading the way to end this disease, we don't stand alone. We're doing this work with the help of people like you nationwide, and dare I say it, to some degree, people like me, who have joined the fight and supported the association so that it can in turn provide these vital resources. So what are those vital resources? And before I introduce Dr. DeStefano, I'll enumerate some of those. There's the big one, the helpline. Everyone at the association, as Cody knows, has this number memorized, 1-800-272-3900. Please put that in your phone. We're available around the clock, 365 days a year. It's a free service. It connects you with specialists and master's level clinicians for confidential support. And when in doubt, if you don't have the number memorized, just go to the website. The place to go is alz.org. That's where you'll find local programs, services, and support groups to connect with in real life. We also work with volunteers. I should know, I'm one of them, and those volunteers are vital to 2 of the most well-known activities the association conducts. You've probably seen these people walking around with oceans of purple and purple shirts doing the annual Alzheimer's walks. There's 600 of them around the country where we walk a few kilometers and raise some important funds. It puts the fun in fundraiser, right? And of course, there's also the longest day, in which volunteers raise funds 100 of different ways on the summer solstice, which is, of course, the day with the most light to fight the darkness of Alzheimer's. I like that. As a writer myself, I like that. It feels poetic. The point being, you too have the power to help us, and we urge you to do so by volunteering. Whatever your skill, whatever time you have, it's time well spent. And Cody, who introduced us on this call today, who's on this call right now, will crawl over broken glass to take your contact information. Cody and the volunteers are ambassadors. See, Cody, I just made you an ambassador for the vision of the association. On the next slide, you'll see it: a world without Alzheimer's and all other dementias. Now, let's get started with the expert of the hour and today's special Ask the Expert program, namely Hearing Matters, What You Need to Know. And to lead us in that discussion, Dr. Michelle DeStefano is a certified dementia practitioner with specialized training for people like us, for people who are caring for individuals with dementia. What's more, as the director of the CHC's Shelley and Stephen Einhorn Audiology Center and Barrelson Hearing Technology Center, and as an audiologist working with clients of all ages, her approach is to treat people exactly as she would want one of her own family members to be treated, which, speaking for many people on this call, and speaking for myself, I'm sure is much appreciated. And as Cody mentioned at the outset, remember, please feel free and don't be shy to type any questions you have into the chat box. We will address those during our Q&A period at the end of the presentation. So with that, Dr. DeStefano, the floor is yours.
Hi, everyone. Let me just share my slides. Give me a second. All right. We'll just get started. A little bit about myself. Thank you for that wonderful introduction. I am the Director of Audiology at the Center for Hearing and Communication. We are located in Manhattan, down by the Financial District, by the Stock Exchange. I have been an audiologist for about 25 years. I see all ages, a couple weeks old to my oldest person is 101. So we span the whole gamut. And I'm really pleased to be here today. I find cognitive decline and how I can help as an audiologist really a passion of mine. So I'm happy to speak about this with you. So let's just discuss the agenda quickly. It'll be a brief introduction to CHC, a little bit of information about hearing loss and the overview of hearing loss, and some research on untreated hearing loss and cognitive decline, as well as some of the services at CHC for individuals with hearing loss and how we can help in some way. And then we'll leave some time for Q&A. So a brief introduction to CHC. The Center for Hearing and Communication is a nonprofit organization. We've been providing services since 1910. We were previously known as the League for the Hard of Hearing. We are a nonprofit, as I said, and we have a based in Manhattan by the Stock Exchange, and we also have a location in Fort Lauderdale, Florida. We see pediatrics through adults. What our vision is communication without limits. And what our mission is to provide high quality, comprehensive services to empower people affected by hearing loss, deafness, or any other listening and communication challenges. We have 4 clinical departments and our outreach department. There's audiology, where we provide diagnostic testing, as well as rehabilitation, including services like hearing aid fitting, assistive devices. In our audiology department, we also have a technology department run by a hearing instrument specialist, and he provides any kind of technical services. We have walk-in hours, and we're able to provide on-the-spot care for hearing aids and assistive devices, which we'll go into later. We have emotional health and wellness. Our emotional health and wellness department is made up of, we have 1 psychiatrist, and we have psychologists and social workers who see children and adults. They have experience working with those with hearing loss, but that's not that they only treat people with hearing loss. They treat all mental health concerns, but they are aware of how to handle hearing loss, dealing with hearing loss, dealing with a loved one with hearing loss, and they all are fluent in American Sign Language, which is pretty unique. We have an education department, which provides academic services and support on-site as well as in the schools for children and college level students. And we even have some adults who have gone back to school that we help and support. And we have a speech and language department, which provides speech therapy and rehabilitation for children and adults who have hearing loss, are getting used to hearing aids or cochlear implants. And then we have our outreach program. And our outreach program, we do informative sessions to allow people to understand a little bit about hearing loss and how it affects your life and how to treat it and answer some questions. But one of the wonderful things about our outreach program is we have a mobile testing unit. It's a van that goes to senior sites as well as preschools and Head Starts, and we do hearing screenings and hearing evaluations. And now shortly, we will be starting doing hearing aid demonstrations on that van as well. And so it's important for us to really get the word out and information out about hearing loss, since it is considered somewhat of an invisible disability. Okay, so we're going to do some brief information about the ear and hearing loss. So this is a picture of the ear. And primarily older adults are dealing with hearing loss from the inner ear, that little spiral snail-shaped portion there. That's what's called a sensory neural hearing loss. Hearing loss from the inner ear is permanent. It does not improve. You can have hearing loss from the inner ear from childhood. You can actually be born with that, or it can progress in adulthood. Most older adults will have a hearing loss from the inner ear in the high pitches. It's just what can occur with aging, similar to how you may need reading glasses over time. The reason that I think it's important to understand hearing loss, there are different degrees of hearing loss. Some people may have just a mild loss and you may not really even notice it in quiet, but you would notice it if you're at a further distance from the person, or if there's any kind of background noise or the signal is degraded at all. And some people will have a more significant loss where when you're speaking to them or even doing an evaluation or working with them as treatment, they may not fully get what's being said. And I just want to kind of put in my little soapbox about why it's necessary really to at least have a baseline hearing test. And we'll discuss hearing tests a little bit later. But I not too long ago had a client who the daughter made the appointment for her mother. She was receiving evaluations and was getting a diagnosis to determine dementia and cognitive decline. And the daughter really felt like the answer she was getting was more severe than her experience with her mother in a one-on-one quiet situation. And so she brought her in for a hearing test. And when we did the hearing test, we actually found that she had a significant hearing loss, what's called a moderately severe hearing loss, which means an average conversation level, she was barely hearing. So as she was going through those evaluations, if there was any distance from the speaker, if any part of it was through Zoom, she was not actually hearing everything that was being said. And because there is some cognitive decline there, she was not voicing that she wasn't hearing it as well. As she also told me she thought she was doing fine until we tested her. And so we actually did fit her with hearing aids and request that they had a reevaluation. Now, it didn't get rid of the fact that there is some cognitive decline there and there is some degree of dementia there, but it did find that it wasn't to the severity that they thought, and communication with her has been much easier, and they're able to do more treatment with her that they know it's really impacting. So it's important to always make sure before you do any evaluation or treatment that they have a baseline hearing test or that you have some idea of their hearing. So what are some causes and signs of hearing loss? Just quickly, in the interest of time, causes can be genetic, family history. Noise exposure is a very large cause of hearing loss and the most preventable. All you need to do is wear some hearing protection. You can get them universally or custom made. Aging is, of course, a cause of hearing loss. Ototoxic medications, certain medications can actually decrease your hearing ability, and then sudden hearing loss can happen. And then what are some signs of hearing loss? Well, of course, if you saying what more frequently, or if you are actually asking for repetition, people like to say family members mumble or their grandchildren are mumbling. It's really that you're having more difficulty hearing. But the more subtle ways of telling would be they have difficulty in a noisy situation. They're great one-on-one, but in a restaurant they have trouble. They change their sociability. So you notice that they start having more social isolation, or they don't want to really go out to dinner with their friends like they used to once a month before. They may raise the television or switch ears on the telephone. If you are more than 3 feet away and they're having trouble hearing you, that's also a sign of some difficulty with hearing. Typically, people will be able to hear you well within 3 feet if there's no hearing loss. The second you start giving more of a distance and there's more difficulty hearing, then that would be due to some degree of loss. And again, hearing loss does not have to be across all the pitches of speech. You might have really good hearing in the bass pitches, which would be like men's voices or vowel sounds, and decreased hearing in the high pitches, which would be like sounds like S and F, how you hear in background noise, women, children's voices, things like that. Okay, so let's talk a little bit about the risks of untreated hearing loss in adults. So we've always known that untreated hearing loss does affect your hearing ability, and it does affect how you understand words. But what we have found through a lot of more recent studies as well, but has been around for a bit, is that untreated hearing loss, which develops later in life, it has more association with increased depression, risks of falls, as well as dementia, including Alzheimer's. Now, it's important to know that there's still a large stigma around hearing loss and treatment for hearing loss and hearing aids. And we know that it takes people about 5 to 7 years to seek treatment for hearing loss from the time they notice they're having difficulty. And that's really important to know, because typically those who have some form of cognitive decline have had hearing loss for about 10 years prior to that notice. And there is an association, as you'll see as we go on in slides. So as far as depression goes, untreated hearing loss is linked to a 50% greater risk of depression. And that's because they will have a greater chance of social isolation, not wanting to participate because it's just more difficult. You have a 30% greater chance of having an accidental fall if you have untreated hearing loss. And in fact, your risk of accidental fall increases with the degree of hearing loss. So the more hearing loss you have, the greater the chance of having an accidental fall. And then most importantly for this discussion, we know that untreated hearing loss increases the risk of dementia by 2 times that of those with normal hearing for a mild loss, and actually 5 times that of those with a more severe loss. And because hearing loss is a hidden disability, it's very hard to know who is experiencing that. We also know that hearing loss is one of the most modifiable risk factors for cognitive decline. And so we just want to stress that it's really important to have that baseline. Now, the other thing, because there are so many risks in common for hearing loss as well as cognitive decline, it's important to know those too, because when we're at CHC, when we are dealing with clients, they have a lot of medical backgrounds. We kind of know there are other medical conditions happening. You will have a higher risk of hearing loss if you have cardiovascular disease, if you have diabetes or are pre-diabetic, if you have kidney disease, or even osteoporosis, because there are little bones in the middle ear. So the link between untreated hearing loss and cognitive decline has been studied significantly. Johns Hopkins has done a lot of studies, Frank Lin has, and we're just going to discuss a little bit of those. So research showed that the greater the hearing loss, the greater the risk of cognitive decline. We know that you will have a higher chance, a 5 times greater chance with a severe hearing loss, and a 2 times greater chance with a mild loss. And as I said, hearing loss is the leading modifiable risk factor for dementia. And we know this through a recent study in 2020, where they actually went through some of the risk factors and saw which one that they can actually treat and change to see if there was a change in how they would score and perform. And we know that the easiest one to change is hearing loss. It's the easiest one to treat and put some information into the ears. And the thing to think about why there's such a large association as well is because 1 in 3 people over the age of 65 will have a hearing loss, and 1/5 of those over 70 will. So it's important to know that if you're dealing with older adults, most likely there is some degree of hearing loss present. The current research on hearing intervention, which I'll discuss a little bit as well before we get into some treatments, are actually very interesting for us. We have known that untreated hearing loss does lead to a decrease in word discrimination and word understanding. And so that being said, some of the reasons that they think there's a link between untreated hearing loss and cognitive decline is brain atrophy, because if there isn't that stimulation to that area of the brain that deals with language and comes from your hearing, then there is a decrease in that discrimination, that understanding, and a possible brain atrophy. That there's a less social engagement, so you have less chance of actually going to a class or going out with friends, or perhaps going to listen to a lecture if you're not hearing it as well, because it becomes just too taxing to do. And then also the cognitive load on the brain to be able to put in the effort to listen, as well as then also process what's being said. So current research, 2 studies that are very interesting. One is still ongoing, and one was put out in 2023 is the ACHIEVE study. It's aging and cognitive health evaluations in elders. It was multi-center, and what I found extremely interesting about this study, it actually studied those who were considered cognitively healthy, and those had significant risk factors for cognitive decline. And what they found for the older adults with the significant increased risk factors for cognitive decline, some form of hearing intervention that provided benefit actually slowed down the loss of thinking and memory ability by 48% over 3 years. So by getting that input in, it actually created some slowing down of the cognitive decline. They actually are continuing the study to see if they can find a way to mimic this in those who do not have risk factors. And then there's the ENHANCE study from 2024. It's an evaluation of hearing aids and cognitive effects. It's out of Australia. It's a longitudinal study. And what they're actually studying is if hearing aids and early intervention of hearing loss can actually stave off cognitive decline. And at this point, like I said, it's ongoing right now. But what we're seeing is that there is an inclination that you might be able to stave off cognitive decline as much as 3 years with actual good intervention. So let's talk about what we could do as intervention. So the very least, you can get an online hearing screening. We have them at CHC on our website. You go on, you click on the hearing screening, put on whatever headphones you have home, make sure they're connected to the tablet, laptop, whatever it is you're using. And it actually tells you, puts you in a bucket of no issue, minimal issue, significant issue. And then you would know how to follow up from there and get a hearing test. There's also one on Johns Hopkins that gives you a hearing number. CDC has one. There are several that are in existence. You want to also seek a complete hearing test. In my opinion, everyone should have a baseline hearing test. But if you are going to be working with somebody or know someone is getting an evaluation regarding cognitive decline, it's really important to make sure that they know their hearing. They need to know their baseline hearing. A complete hearing test means you come in to see an audiologist, you sit in a booth, press a button, raise your hand when you hear the sound. The main thing that you want to do is it's not just acuity of the different pitches in speech, you also, what volume do you hear at? But you also want to know your clarity of speech. What's your word discrimination? How much are you able to actually discriminate what's being said? And then the things to think about, as far as what we do at CHC is other special considerations for those with dementia. So, do you actually give them extra time, because perhaps you may need more than the typically allotted time to do a hearing test. At CHC, sometimes we do what we call a pre-appointment. So I meet with the client and the caregiver or the family member that wants to be a part of the appointment to get an understanding of what they need and what they need to expect from their hearing test, and know so that I have all those accommodations in place when they do come into me. The other thing is you want to think about how to modify your test for their cognitive level. There are some people who come in, they have mild cognitive decline. We do the full hearing test, but maybe some word retrieval is an issue. So perhaps I have to change my speech testing. Sometimes it's more significant. I need to take breaks in my testing. I need to use what's called closed set testing. So when you hear a word, you don't necessarily have to retrieve it or verbally or say the word. You can just point to the picture of the word, or you can point to a picture that represents the word. We also may actually change the way we test. So maybe you can't come in and click a button when you hear the sound, or raising your hand's difficult because motorically you're having some issues. So instead, we may have somebody assist us in that booth where you put a peg in a block, or you just tell us yes every time you hear it. So there are ways to make the test a little bit more accommodating. And then it's important to know that Medicare covers hearing tests. They will cover at least one a year, and they will cover multiple in a year as long as you have a prescription from a physician. Medicaid covers hearing tests, and most major insurances, private insurances, do as well. And then let's just talk a little bit about hearing technology and intervention. So you can see to the side some hearing aid options. There are a variety of styles, options, types of hearing aids that you can get at this point, including over-the-counter hearing aids. And because there are a variety of types, there is also a variety of price points. And so we see at CHC, a lot of people feel that the reason they don't pursue hearing aids is because they're just not affordable. Well, a lot of insurances will cover hearing aids to some extent. Medicaids, including managed Medicaids, cover hearing aids. Medicare does not at this point. But there is really a range of pricing for hearing aids. They can be anywhere from like $1,800 for two, all the way up to, unfortunately, no real regulation on this, $7,000 for two. But it doesn't mean you need the highest end technology. You just need some technology. They do have Bluetooth connectivity, which means they'll connect to any Bluetooth device. And they will have directional microphones. Right now, a lot of hearing aids have artificial intelligence in them. They read the environment. So in the past, you turned a hearing aid on, everything got louder. That's not the case anymore. It's digital with a chip. It reads what the environment you're in. If it's quiet, it amplifies everything because you want to hear everything in a quiet room. But if it's noisy, it will filter that noise and give speech a preference. They are typically rechargeable, so you don't necessarily have to worry about dexterity concerns with changing a battery. You put it in a charger, take it out of a charger. You can get battery operated if you choose, but the rechargeable seems to be the easiest to do at this point. Plus, it's more cost effective. And there are over-the-counter hearing aids. What we're finding with over-the-counter hearing aids is, unfortunately, the price point is not what we suspected. A good pair of over-the-counter hearing aids that you get some support on how, like online on how to handle, are about $2,800 to $3,000 for two. And we are finding that they are working better for those who have a mild to moderate hearing loss. That's what they are approved for. The people who are on the more mild side notice the most benefit from them. And then you want to have considerations for those with dementia or cognitive decline. Because there are several things you need to think about. Is television very important? Are they doing any kind of music therapy? Are they in situations where there is music? So, or having any kind of speech therapy or any other cognitive therapy, that it would be better if they had a direct signal into their hearing aid. So they're like a wireless headset that works for your hearing loss. Most of them work with a cell phone with an app, and that acts as a remote control. The great thing about that is it also has Find My Hearing Aids, kind of how you can find your cell phone. And so it has a loss location finder. Fantastic. It actually has gotten much better. It can tell you down to the address of where it is. So if you lose a hearing aid, you can easily find it now. The app also allows the caregiver to be able to monitor the hearing aid more, and you can do remote programming. You don't necessarily have to be in the building. I can be at home on my laptop or at the office on my laptop. You go on a tablet or your cell phone, and I can get into the hearing aids and remote program them. That's been very helpful for those who have limited mobility. The things to think about at this point too are like, how do I modify the devices for those who may have cognitive decline? One of the things to think about is a lot of times spatial relations kind of gets lost. And so I say put the right on the right ear, and by the time it gets to here, we're confused which side, or perhaps by the time it gets to here, it's flipped around because you lose a little bit of that ability to do so. And one of the things you can do for that is just kind of easily make the parts as small as possible. So you may not need a hearing aid with 2 pieces. Let's just get something that's small, 1 piece, they just put straight in. Or if you're charging it, it's difficult to remember which side's right side and left side. You can easily label them, make sure it's always, I have one client who we put Velcro and on her nightstand and Velcro on the charger, and the Velcro has to only line up one way with a big arrow on the charger and on the Velcro, and she knows that's how it goes down. And then we label the charger right and left, and so she's always on the right orientation when she's actually adjusting and putting them in at night, and she's able to do it on her own at this point. Vision is a consideration. Sometimes it's hard to see the part you're dealing with. We use a lot of raised dot stickers. We use any kind of textile to kind of help feel the difference between the two. And then what are some solutions for TV, your tablet, and your phone? There's been a lot of advancements recently, including captioning, which is really important because for those with reduced hearing ability, captioning and any visual support is very helpful. But for those with cognitive decline, a visual reminder is also helpful. So you can do captioning, whether it is through an app like the that you can download, or now through Apple, and even on some Android devices, they have live transcriptions that you actually can just turn on. You don't need to download a separate app. It can be on a tablet. You can do closed captioning like we have on Zoom right now. You can also have captioning on a television, on your tablet or laptop or your cell phone, and cast it through Chromecast onto a screen. The other thing to think about is you want some audio enhancement. So if I'm talking to somebody and I notice if I cover my face or if I turn my head, they have more difficulty hearing me, they need something. And maybe you can't get a hearing aid right away, but at the very least, you can get something called a pocket talker, which you can see my arrow is on that right now in the corner right of your screen. It's headset with a little microphone and amplifier, tone control, and it allows us to actually put just amplify the sound for them. So it's very easy, makes it louder. Now, again, louder may not always be better. You need to understand if the person has good clarity and understanding of speech, because your word discrimination will dictate how much you will benefit from a hearing aid, or even just raising the volume. So if clarity is missing, then it's very important to have a prescription hearing aid professionally programmed, because that can return some of that clarity back. But things like a Bluetooth speaker or an amplified telephone, TV ear, something to amplify your television, are all ways that you can give some enhancement right then and there quickly and not have to worry about getting into a hearing aid. What are some other helpful solutions? You can see in the corner there on the left, that's our receptionist. We have captioning when you walk in, so that everybody has the ability to know what's being said. It started during right before COVID, actually during COVID more so, and then now we continue to use it because it's been so helpful. These are some of the apps that you can use for captioning. There's Otter, there's Ava. There are free apps. Some of them you have a certain amount of captioning for free, and then there's a paid amount. Google Live Transcribe, as I said, is another one that is wonderful. It actually has transcribes very well, and you can pick languages. I don't know if those of you know on Zoom, you can also pick a language if needed. And then there are some ways to kind of deal with safety. So there are alerts for safety that you can purchase. Things like that will tell you when the doorbell rings, or when if a light is on that you don't want on, the telephone rings. There are ways to even know, is there a dripping faucet, or is something left on, which quite often there may be forgetting to turn off a faucet, or forgetting to turn it off all the way. And you actually can get, it's an app, and it changes the color of the water coming out so that it's visibly easier to see, and it can be an alerting system to those around. You can, on your own iPhone, go into sound recognition. You don't have to have anything extra. You don't have to download an app. It already exists. And you can then have, every time the dog barks, your phone alerts you. There are home systems that do wonders for sound and alerting systems. You can hook up an Alexa, those dots, to a smart TV and actually be able to turn the TV on, lower the volume, things like that. That would help, but also allows you to turn on captioning or pull things in. And then there's also your watch that can do it. And then some communication tips. You always want to make sure that you're in good lighting, that you have a quiet background if possible. Try and have the most quiet system that you can. Make sure your face is visible. You want to make sure that you do speak up, but don't distort your voice. It's always good to write things down. If you're giving an address, telephone number, you want to be able to give the letters to a name. When you're spelling out things or giving a number, it's very hard to hear the difference between 50 and 15, say 50 and 15. And another thing is, when someone says what to you, it's always good to get good specific clarification. So what did you hear me say? How or if you are the person who didn't hear well, say, I heard you're going to the store. What was it you need to buy? And then the person will typically rephrase what has to be said. And then the rephrasing allows you to understand much better. And you also want to try and speak clearly and slowly. Someone with difficulty hearing is always going to have trouble with faster speech, somebody with an accent, somebody who is more soft-spoken, and unfamiliar language or words. Anything that's familiar is easier to follow. And then just some things about CHC services for individuals living with cognitive decline or dementia. As was mentioned earlier, I'm a certified dementia practitioner, and some fancy letters, but what it means is myself and one of the other audiologists got specifically trained on working with those who have dementia. So I was very fortunate to have the training done, part of my training done by someone who works with those with hearing loss. And so they were able to give us some tips, some things that you can do to make it easier for the person who is dealing with hearing aids or hearing loss and has dementia, like the modifications I mentioned earlier with testing. The other things that we do is functional listening assessments, and that's done by our speech therapist. And what that means is it's very difficult to kind of determine. We always verify the benefit of hearing aids, and we always make sure you have a hearing aid on. How do I know it's working for you? And there are some objective ways to verify that. There are machines that can tell us while it's on your ear, is it set appropriately? Is it doing what it's supposed to do for your hearing? But we hear a majority with our brains, so we need to know what you're doing as well. So at CHC, we'll test you in a booth with the hearing aids on and make sure that you're actually hearing words at an average conversation level, hearing words in background noise. But sometimes it's hard to tell, is the cognitive level coming into play or is it the hearing aid? And so that's when we enlist our speech therapists to do a functional listening assessment. And they actually do an evaluation of their understanding of language, of speech. They make it more difficult. They put on background noise and they see where the errors fall to be able to determine, is it cognition or is it the actual hearing ability? And from that, then they're able to offer some either tips or communication tips or things to the audiologist to adjust further, or some adult rehabilitation, where they actually work on improving that listening skill and some auditory training. We can do remote hearing tests with a tablet, which was again discovered during the pandemic, but has been very helpful for people with reduced mobility. So as long as you've had some baseline hearing test in a booth, we are able at this point to do a full hearing test with a tablet. We have remote programming, as I mentioned earlier. We have support groups for adults with hearing loss of all ranges. And we have something slightly unique to us is a hearing aid orientation course. It's done virtually through Zoom. We do it 4 times a year, and it's done over the course of 3 nights. And it's been really well received. Caregivers can attend, people who have hearing aids can attend. When you get a hearing aid through us, it's part of the purchase. You just are enrolled in the course. And you sign up, you sign on to the Zoom meeting, and you learn about, again, how to take care of your hearing aid, how to clean the hearing aid. If dexterity is a concern, what else can we do when you have to clean the hearing aid? Who can do it for you? How can we modify it? Maybe we need to reduce that portion and make it something that doesn't need as much cleaning. We talk about other apps and other ways to support your hearing, remote microphones, other assistive devices that can be used. How do we hook up to a laptop? And then we also often bring in somebody from our mental health department to talk about really the emotional effects of hearing loss and how coping with hearing loss and a loved one with hearing loss is can be dealt with from the mental health perspective. And I like to say, to me, the thing that I think I want to emphasize the most, you heard earlier that I make sure that I treat everybody the same way I want myself or my own family members to be treated, is an audiologist really needs to take the time to know you and your needs, or your client's needs, or your family members' needs, to know how to address those specifically. There should be accommodations for every person, because every person has different hearing journey and every person has a different hearing need. And patience is the biggest thing. We need to be able to be patient. Sometimes you can't get it all in one visit. Sometimes we need to think out of the box to figure out what to do, but patience is really one of the most important things. So in CHC, we are lucky to be able to have to not rush appointments. We can make those accommodations. We have walk-ins for technical services if something is broken or not working well. And we also have sliding scale. And so we'll leave some time for questions, and hopefully I can answer some of them for you. And here's my contact information. And we'll put it in the chat as well.
Yes, thank you so much, Dr. DeStefano. It was great content. I definitely was able to take away a lot of information in relation to supporting our, hearing impairment community. Just for my own feedback, I'm pleasantly surprised, but also really happy that we've made significant strides with being more inclusive, just in relation to the apps that are offered, the improvement with hearing aids. I personally wasn't as up to date with all of this, so I found that to be really informational. So thank you for that. We do have a couple of questions that came in today that I want to share with you. So we have Kristen asking, is it possible to have hearing loss due to inner ear problems? Example, fluid in the Eustachian tube. What test would show this?
Sure. So a majority of older adult hearing loss and permanent hearing loss is from the inner ear, which is called sensory neural. I think, Kristen, what you're asking about is hearing loss that can be from fluid in the ears or what's called a conductive hearing loss. And typically those are not permanent. That's more transient. It can get fixed over time. But anyone who's had a really bad head cold and your ears muffle out, or flu and you couldn't pop your ear, that's considered a conductive hearing loss. It means that your hearing diminished because of that middle ear space being filled with something, or the eustachian tube, as you referred to, not popping your ear well. So yes, you can. A regular hearing test will show that, because when we do a hearing test, you wear headphones that checks how you hear through the whole system, the eardrum, your middle ear to your inner ear to your hearing nerve. And then you also test the inner ear. So you bypass that fluid that can be there and you get an idea. There's also objective testing that's done where we put a little probe in the ear and it measures how the eardrum moves and a response from the inner ear. So you don't always have to have somebody participate. There is quite a bit of objective testing that can be done.
Well, thank you. Thank you, Michelle.
Mm-hmm.
All right, so next question is, what are the symptoms of audio neuroma that help the doctor diagnose neuroma without the need of an MRI?
So I think you're referring to an acoustic neuroma. And so for those of you on here who might not know what that is, an acoustic neuroma is a small tumor on the nerve that goes for hearing, so the hearing nerve. So unfortunately, some of the symptoms of that are also symptoms of several other things. So you always want to seek medical help, whether it's an initial hearing test. When we do a hearing test, there are several things that will flag for me that there could be an acoustic neuroma, a difference in hearing between the two ears, because only one ear should have that tumor there that's growing, causing a hearing loss only on one side. There could be some dizziness or feeling of imbalance. Again, several older adults will have dizziness or imbalanced feeling for many other reasons, so it's hard to determine that. You might have a ringing or buzzing in your ear, but when you come in for a hearing test, there are red flags for us that tell us if you need to see a physician. And unfortunately, no matter how many other tests we do, typically an MRI is what actually shows, because you need to know if it exists and the size.
Right, thank you so much. I also have in the comments, we have Susan. She stated that she is, as a former teacher of the deaf, she's very pleased with the quality of the presentation. So
you,
she says
Susan.
that her very own doctor has a sign when you sit in chair, and there's a sign of, I guess the warning of hearing loss and dementia. So just some feedback again from the presentation today. You
Thank
did a
you,
wonderful job,
Susan.
Michelle.
I would say, I'm going to say, to piggyback on what Susan said, if you can educate doctors as much as you can, geriatricians as much as you can, we find that they're the first person you go to if you're having trouble, right? But they don't always refer for a hearing test, oddly enough. And so we are on a bit of a mission to educate. We've joined with another group called the Audiology Project to help educate some people on why you need to refer, and why, if you're dealing with older adults, it's even more important. Or if you notice that there's diabetes, you definitely need a hearing test. So
Getting the thumbs up from Susan. Thank
yeah,
you
so
so
spread the
much.
word.
Exactly. Absolutely, absolutely. Education is power. Information is power.
Mhm.
But I'm not seeing any other questions in the chat. Before we close out the session, again, just wanted to open it up to anybody here that joined us. Please feel free to unmute your mic, and if you have any other questions, feel free to ask away.
I was just going to ask, do you still offer sign language classes for adults who may be going beyond what they can do with a hearing aid?
Yeah, we no longer offer sign language classes at CHC because there are so many places you can get them. My information's in the chat if you're interested at all. Just reach out and I'll let you know. I mean, there's even online classes, so it just wound up
I know of
the
some places,
demand.
but I know that people
We
really
used
liked
to.
your program.
Yep, we used to, but there was less of a demand, so we haven't been.
And I also wanted to mention the Sennheiser device for watching television, which is really a great device for anybody in the beginning of hearing loss. It's easy to use. You just leave it in its charging station, so it's always available. And it connects easily to the TV.
Yes. Yeah, one of the great things of the newer televisions too, that they typically have Bluetooth, the newer smart TVs, and because hearing aids are getting better at their Bluetooth capabilities, you can connect directly into a television sometimes. That's another thing we do. We do a lot of troubleshooting for other devices in the home at CHC.
I
And
was just gonna ask that. Thank you. Thank you.
I was also going to ask if someone has a hearing aid and they're not sure that it's right for them, but they bought it someplace else, could they consult with you?
Absolutely. Yeah.
Okay.
Mm-hmm.
Yeah, that's the problem, that so many people don't go back after an initial hearing aid is given to them, and then they put it in the drawer, or they don't bother to
Right.
use it because they haven't gotten it to the level that it should be at. So I think that's very important service.
Absolutely. And verification of a hearing aid is very important. I can't tell you how often people come in and say, I got the hearing aid, and all they do is ask me, how does it sound? Can you hear me better?
Yeah, that's not too far.
Of course you're going to hear, right. Of course you're going to hear better. And we do know, studies have shown that people won't ever report that they're hearing better. It's a comfort level, not an optimal level. So when you're self-fitting a hearing aid like an over-the-counter, or you're reporting to someone, that's your comfort level, not your optimal level for hearing. So it's important that there's at least some objective and some responding and subjective verification that you're getting the benefit you need. So absolutely. We see a lot
Yeah,
of
I feel concern about over-the-counter hearing aids because people sometimes don't recognize that they've gone beyond a mild hearing loss and are at a point where the over-the-counter is not going to work for them, and it's been so pushed. And have you tried to do anything with the industry about that?
Yeah, so we're actually have been working with, well, I personally am part of our state organization, so I've been working with the other organizations regarding getting information out and over the counter and what we can do. But also we've been working through CHC just to do education sessions on over-the-counter hearing aids versus prescription hearing aids, what they mean, what they are. We actually offer a 15-minute free consult if you think you have trouble hearing and you would be a candidate. People send in their hearing test. 9 times out of 10, you are correct. You go, no, you're not a candidate. Your hearing is worse. But we also have had people come in that they've gotten hearing aids, over-the-counter hearing aids, and they're not sure if they're actually benefiting them. And they'll come in and we'll actually do some testing with them to see if they are. And if we can adjust it with them, we do. If we can't, we explain to them how to get it adjusted. Because again, right, it's pretty arbitrary at this point.
And there's been such a push that anybody who's got a hearing loss can just go in and get one over the counter. And that really concerned me when I first saw that. So, I know that it can be a problem.
Yeah. On the plus side, it's at least helping with the stigma and getting talked about more, and getting people to kind of put their tiptoe into the getting hearing aids and treatment. So at least we have that.
Pains and hearing aids are
Yeah.
the hardest ones. People assume that it makes them look old. And I think, those are the two issues.
That's
Those
very
two
true.
things.
Very true.
Okay,
Well, I wanna
thank you
thank
so
you.
much. I was so
Oh,
impressed.
you're
And
welcome. Thank you.
yes, thank you, Michelle, as well. Phenomenal. I know I personally have learned a lot during this session today.
Good.
Association is very grateful to partner with you guys. And just to reiterate in the chat, it looks like Angelia was asking if we're gonna receive the recording to this. Absolutely. There's a lot of great resources that Michelle had shared with us today. I personally will also be going back looking into some of those resources. But again, just want to extend my gratitude to Michelle, to Caroline, to Kevin, for everybody for contributing to such an informational and successful session. So with that, we are a little bit over time. I will share the link. All registrants will be receiving the link soon. And again, feel free to share this link with anybody that you may know that is either impacted or just wants to learn a bit more about, Center for Hearing and Communication, as well as the Alzheimer's Association. I thank you all. Have a wonderful rest of your week.